avec la présentation de notre collègue et confrère qui nous vient de Turquie, donc le docteur EGE CAN, qui donc nous présente un sujet sur le micronutriment, donc supplémentation and fertility, does it work? On vous donne la parole. Merci beaucoup.
Dear ladies and gentlemen, thank you very much for this warm invitation. It's a very big honor and pleasure to be among my Algerian brothers and sisters. Once again, I'd like to extend my sincere gratitude to Dr. Bahati for making this happen. So in my presentation, I will be briefly mentioning about the micronutrient supplementation and fertility. Does it really work? This is one of the most debated topics in the guideline committees that I'm also involved in. We are discussing two major topics: varicocele, when to intervene, and the second most important topic is that. I cannot see my presentations here. Is it possible to have them here? The presentation is not here. Yes, okay. And this is not working also. Okay. So my colleagues before me made my job easier. They described what is infertility, what is the importance of male infertility. Unfortunately, the business of IVF is mainly led by obstetrics and gynecologists. I have no objection to that. Obstetricians, gynecologists know reproductive medicine more than us urologists. We are more focusing on stones and prostate and other things. But approximately 50% of couples have a male fertility issue. This is important. I mean, yes, we are reproductive medicine. Our primary goal is to have a baby. But we also need to remember that we are also medical doctors, and we need to understand what is wrong with this man. If there is a problem in sperm, we know that there is something wrong with this man. Therefore, it's our responsibility as medical doctors to find the underlying cause and cure this underlying cause if possible. And today we know that 52% of male infertility cases are from curable diseases. So instead of immediately jumping to the assisted reproductive techniques, we may consider being a good doctor and try to understand what are the underlying causes and if we can treat them. What are the etiological factors? Well, as I've said, 30% female infertility, 30% male infertility, and approximately 30% both male and female infertility we are seeing. And in this slide, you can see the causes of male infertility: maldescendant testicles, varicocele, sperm antibodies, testicular tumors. Idiopathic causes, 30% of the cases are due to idiopathic causes. We don't really know why it's happening. Hormonal problems, genetic diseases, infectious problems, and etc., etc. They are causing the problems with male infertility. Why there is a rise in male infertility? This is the famous textile merchant. His name is Anthony de Leuvenviens. He was a textile merchant, and he developed a small microscope to assess the textile of the things that he's merchandising. And then he started to use his microscope to check what is going on in the nature, and somehow he started to check his ejaculate, and he observed some moving animals. Animalcule, he named it. Hayvanat al-Manawiya in the Arabic countries, it's said. So that's how it is described first. It is the smallest cell in our body. Its development takes 65 to 72 days. It loses its organelles during the development because it has to have a small head, a neck which is rich of mitochondria, and the flagella, a tail. All the organelles, endoplasmic reticulum, Golgi body, and etc., are gone. Because of those, this cell is very fragile, highly sensitive to environmental factors. And because of that, in the last 50 years, we have lost 50% of our sperm concentration, 60% of our sperm count. This is a terrible, terrible graph. If we continue like that, most probably within the next 20 to 30 years, we will lose all our sperms, and we will be facing with a lot of male infertility patients. Therefore, as reproductive medicine experts, it should be our goal to stop this decline in the sperm count. I have briefly explained the causes of male infertility, and please pay attention that 34% of them are unexplained. Today, we know that many environmental factors may be responsible for these unexplained causes. What are those environmental factors? Radio frequency, electromagnetic radiation. We are constantly dealing with cellular phones on our pockets, and our laptops are very close to us, and these devices are just spreading a lot of electromagnetic waves. Body mass index, heat and temperature may be responsible for male infertility. Smoking, heavy metals, dioxin is a kind of pesticide, and other pesticides and other chemicals may be responsible for that. Biological causes, especially after pandemic, something happened and people started to use dating applications, and especially in the Western world, we are seeing a very sharp incline in the incidence of sexually transmitted diseases, and those diseases are causing some sort of destruction in the male ejaculatory glands, and this is one of the reasons that we are seeing a lot of men suffering from male infertility. Stress, substance abuse are also in rise. We are all stressed, and stress may also increase free oxygen radicals and may be associated with male infertility. And finally, habitat, occupation, alcohol consumption, nutrition, and diet can increase oxidative stress and may be associated with some sort of detrimental effects on sperm cells. Why oxidative stress is important? Is it really harming the sperm cells? Yes, it is harming sperm cells very severely. Up to 80% of infertile males were found to have increased seminal levels of reactive oxygen species, and therefore antioxidant supplementation is recommended for the treatment of idiopathic male infertility. What does those free oxygen radicals are resulting in? Well, they are deteriorating the membrane structure. So number one, they are destructing the cell membrane. So sperms are starting to lose their cell membrane and they are dying. Not only that, they are also destroying the mitochondrial membrane. When mitochondrial membrane is impaired, the mitochondrial enzymes, very oxidative enzymes, are spreading inside the cell, and they are causing DNA fragmentation and other destructions inside the cell. Also, they are deteriorating the nuclear membrane, and the DNA of the sperm is starting to have some problems. What are the causes of oxidative stress? As I have mentioned, the male accessory gland infections, the drugs, all types of drugs. This is one of the things that I tell to my patients. SSRIs, antihypertensives, diuretics, and many chemicals which are given to those patients as drugs may deteriorate the sperm DNA, and they may increase oxidative stress. So by principle, I tell all my patients to stop their medications if they can. Varicocele, my colleague beautifully explained. Yes, we are also underestimating the importance of varicocele, whether a radiologist or urologist do it. The person who does it the best should do it. And one of the important things, the ultrasound for varicocele should be done when the patient is in standing position. That's one of the things that radiologists are missing. And even you have a very good radiologist, you don't need a radiological examination for the diagnosis of varicocele. The diagnosis of varicocele is made with clinical examination. So if you are a good clinician, then you can diagnose varicocele and you can tell the patient that he needs an operation. Smoking, pollution, cancer, and other things may be associated with oxidative stress in the sperm. Okay, can we somehow stop this oxidative stress? Can we somehow cure this oxidative stress in men? Well, in theory, yes, there are many substances which are recommended for the antioxidative treatment of sperm cells. Vitamin C, vitamin E, vitamin B, selenium, zinc, carnitines, coenzyme Q10, NAC, lycopene, selenium, arginine, and many other products are suggested for the treatment of oxidative stress in male infertility. Are they effective? Yes, according to the small clinical trials consisting of 10 to 20 patients, single-arm studies, one center, they may be effective. But today, we are not very much satisfied with those one-arm, single-center studies. We need more controlled, placebo-controlled, multi-center studies, or we need some meta-analysis which collects all this data. And according to the Cochrane meta-analysis, Cochrane does meta-analysis in every 2 years. In 2014, they did one. In 2019, they did another one. In 2022, they did another one. And according to those meta-analyses, yes, they may be partially effective. They had a positive impact on living birth rates, and they may also have positive impact on subfertile couples undergoing assisted reproductive technologies. So we may think that they are harmless, and hopefully they may have some sort of positive impacts. Are these results consistent? Sadly, no. This is another clinical randomized study, MOXIE trial, which was published recently. And in this study, the authors divided the patients into 2 groups, and one group received a treatment with vitamin C, vitamin E, selenium, carnitine, zinc, folic acid, lycopene, and vitamin D for 3 to 6 months, and the other group only received placebo. And the outcomes were a little bit discouraging. The sperm concentration actually fell down approximately 4 million in the patients who are receiving this antioxidant treatment. And the other parameters did not improve at all. Therefore, our minds are a little bit confused in this sense. This is another study. In this study, the authors assessed the impact of folic acid and zinc combination in the treatment of male infertility. And again, this combination did not significantly improve couples' live birth rates or semen quality after 6 months. Therefore, in the European Association of Urology Male Infertility Guidelines Committee, we evaluated all the parameters, and here are our conclusions. Please pay attention to the 3rd row. No conclusive data are available regarding the beneficial treatment with antioxidants in men with idiopathic infertility, although they may improve semen parameters. So obviously, we need more data about this topic, and until then, we may share this information with our patients. If they are willing to give a try to antioxidant treatments, they can, but otherwise, we should not be very much focusing on this treatment. Are they safe? They seem to be. We don't have a lot of data. You know, all those trials are focusing on the beneficial effects of those treatments, and nobody is really paying attention whether they are causing any side effects. There is a significant absence in this part of the data. So in conclusion, Oxidative stress is an important factor in male infertility. Evidence behind supplements is currently lacking. Antioxidant supplements are a developing treatment option with inconsistent evidence. Lifestyle changes may improve sperm quality and the chances of conception. Instead of prescribing costly multivitamin complex, we should at least advise our patients to lose weight, to increase physical activity, to stop smoking, and to reduce the alcohol intake. Thank you very much for your attention.